But why? I did no harm using triple dosage, so I'll continue to use that dose every day. On day 7, Gladys shops downtown Rochester, Minnesota. The miracle of cortisone is born. Now, Dr. Slocum goes into the doctor's lounge and says, Dr. Hench is right. Cortisone is the solution to arthritis. Look at Gladys. Then he gives each a syringe with cortisone with instructions. Go into the halls of the Mayo Clinic and watch for anyone walking slow, stiff, and sore. Go up behind them and give them a shot of cortisone. Well, it may not have been like that, but the time between Gladys and the Nobel Prize was 2 years. They had to have given cortisone to many people with wonderful results. Back to Gladys. Having no reason to change the dosage, she was given the same amount every day. And on day 30, Dr. Slocum says, Gladys, your cheeks are getting a little puffy. That's not all, Dr. Slocum. I'm eating like a horse, gaining weight, and I'm not myself. I'm hyper. I can't sleep well, and I bite at people. Now the red flags go off in Dr. Slocum's mind. I asked him if he knew of Dr. Cushing's work. Oh, yes. A decade earlier, Dr. Cushing observed similar changes in some of his patients, like what happened to Gladys. He wondered why. He found in these people the accelerator pedal of the adrenal glands were stuck wide open. Their bodies were being flooded with cortisone. Dr. Slocum thought, I have too much cortisone in Gladys. By this time, the press is writing articles like, finally there's a solution to arthritis. Cortisone, the miracle drug, and the Nobel Prize people are watching. What to do about Gladys? Gladys is free of pain, morning stiffness, and evening tiredness. Dr. Slocum thinks if he lowers the dosage in Gladys, her arthritis will come back. The press will leave, the Nobel Prize people will leave. Nothing will come of this work. Embarrassment. What to do? Leave her on the same daily dosages. And 30 days later, Gladys shows the signs of cortisone side effects using daily cortisone. Dr. Fichtner had Helen take cortisone to make her pain-free in a week or so. Then no more cortisone until a flare occurred. Upon getting the flare, she took just enough to rid the flare in a day or so. Then she took no more cortisone until another flare occurred. Like with the first flare, she took just enough cortisone to rid herself of the second flare in a day or so. For 19 years, Helen has been doing this to remain pain-free, free of morning stiffness, and free of unearned evening tiredness. She is merely replacing the missing cortisone pulse. Helen has no cortisone side effects. Gladys was overdosed with cortisone. Helen was not. Gladys became pain-free using daily cortisone and got too much. Helen just replaced the missing cortisone and got the right amount. Since thousands have used the Helen plan, now known as microdose therapy, people are telling us through their diaries that they're getting the same percentage relief regardless of which of the 3 major diseases of rheumatology they have. The great physician asks, what's the point? Let me tell you who you are. You are the thinkers with arthritis. You are studying. You are not sitting at home saying, oh me, oh my, look at me, I'm hurting. Pity me, my doctor knows best. If there is something for me, he would give it to me. This thinking puts an unrealistic strain on good people. Physicians work hard all day, and in the evenings their families want their time like your families want your time. Physicians are fine people. We must not put unrealistic expectations upon them. Medicine is so complex today that if one physician were to read full-time, 7 days a week, he or she could not keep up. You are the thinkers. What is the point? One medical intervention, microdose therapy, causes the same percentage relief for the 3 major diseases of rheumatology. These 3 diseases must have a common cause. With one, the inflammation is out of control here. With another, it's there. And a third is over there. The disease is named by where the symptoms are. Microdose therapy means a small amount of medicine when you need it. Today, it is like a table balancing on 4 technology legs, all supported on an education foundation. For disease control, you must be in control of the cortisone tablets. You alone can judge when a flare is occurring and can nip it in the bud. The physician must retreat to prescribing no more than the safe limit of use. Microdose asks you to evaluate your symptoms using a number scale. A 70-year-old had a diary score of 100. After the magic 3-week microdose shower, his diary score was reduced to 25. We said, wow. 2 months later, he came in for another medical examination saying, I wish you would make me feel as good as I was at the end of the magic 3-week shower. Dr. J.B. Irwin, who later wrote the book Arthritis Be Gone, said, I don't understand. You wrote 10 as your diary score today and 25 at the end of the magic 3 weeks. That means you're better today than at the end of the 3-week shower. I am? You see, as the 70-year-old felt the pain cascading from his body during the magic 3-week shower, he said, wow. Then the cascade turned into a trickle. 2 months later, he turned his attention to having no pain, and any pain was bothering him. The diary was essential. We imported 2 technologies into microdose therapy from around the world. Rheumatologist Dr. Richard Panish proved for the first time in a wonderful experiment that some people, not all, are eating one food among many in their diet that fires up arthritis. If you have a food allergy, no matter what we scientists come up with for you, such as new versions of cortisone, Feldene, and ibuprofen, and you keep eating that food that fires up your arthritis, you will never lose your arthritis until you remove that food from your diet. With Helen, it was wheat and gluten. With others, it is milk products, still others, citrus foods, and so forth. Rheumatologist Dr. Thomas McPherson Brown said, I can cure arthritis with antibiotics. And the world said, I don't think so. Now we know. If you're bitten by the deer tick, quickly go to your physician and get an antibiotic. Arthritis is next. Rheumatologist Dr. Kloppenberg of the Netherlands gave a broad spectrum of people with arthritis an antibiotic. Half didn't get better, but the other half got significantly better. If you have a bacterium in your body that fires up your arthritis, no matter what we scientists come up with for you, cortisone, Feldene, Vioxx, you will never lose your arthritis until you kill that bug in your body. We have many friendly bacteria living in our bodies. These help us digest foods. It only takes one to cause arthritis to flare. Now I'm done. I say, hey God, you're good. Helen's fine. I'm going fishing. When I have published our findings in the medical journals, I have no more responsibility to you or to society. But the human being in me kicks in. I know what arthritis did for Helen. I know what it did indirectly for our 4 children and to me. I don't want that happening to anyone else knowing what we know. So I go to the physicians and I say, Dr. Fichtner and I have given this talk before the finest medical conferences in the world. You don't argue with us that we are wrong, yet you don't use microdose therapy. How come? They reply, you don't understand medicine. We are paid on the per-patient visit basis, and that fee is being reduced all the time.